There are 5 important numbers that it's useful to know because they're all important when it comes to your health and your risk of future disease. And they are your cholesterol, your blood pressure, your blood glucose, your BMI or body mass index, and your waist circumference. It's important to know them because if we know what they are, we can make changes to make sure that we're being as healthy as we can be. So let's start with the first one, cholesterol. Cholesterol is a waxy, fatty substance that actually is in all of the cells of our body. We need cholesterol to survive, but it does become an issue if we have too much cholesterol in our blood because that waxy substance can build up and increase our risk of strokes and heart attacks. It gets a bit more complicated than that though because there are different types of cholesterol. There's what we call good cholesterol, that's the HDL. In fact, the more of that we have, the better because that helps to unclog the arteries. And then there's what we call the bad cholesterol, and that's LDL. And that's the one that we want to keep our levels down. Now, there are things that we can all do to look after our cholesterol levels. The most important one actually is diet. So things that we can do are increase the amounts of healthy fats, so unsaturated fats in our diet, in order to lower the amounts of saturated fat. So saturated fat you find in meat, you find in things like pies and pastries and baked goods, and we want to lower those. Unsaturated fats are things like vegetable oil, things like avocados and nuts and oily fish, and they're really good for us. The other dietary thing is to increase the amount of fibre in our diet because the more fibre we have, that can actually help to lower cholesterol as well. Exercise is important, so we should all be aiming to do at least 150 minutes per week of moderate intensity exercise, things like walking briskly, jogging, cycling, swimming, or really anything that gets your heart rate up and gets you a bit sweaty. That can help impact your cholesterol as well. Smoking, really important to quit smoking because quitting smoking can lower your cholesterol, and if you're consuming more than moderate amounts of alcohol, reducing your alcohol intake can also impact your cholesterol levels. The next number to know, or 2 numbers actually, is your blood pressure. This measures the force of the heart to pump the blood around the body. So you'll get 2 numbers. The higher one is called the systolic, the lower one is called the diastolic. Now, if your blood pressure is lower than normal, that doesn't usually cause any problems in relation to your health. So it's only if you have symptoms, feeling faint, that needs to be addressed. But if your blood pressure is higher than normal, well then that can increase your risk of things like heart attacks, strokes and other types of heart disease. So it's important to get it diagnosed and it's important to treat it. The third number to have an awareness of is your blood glucose or blood sugar. Glucose is our main source of fuel, and the amounts that are in our blood are usually detectable by a blood test. If your level is high, then that could mean that you either have or are at risk of type 2 diabetes. And again, this is something that's really important to test in order to diagnose, because in the early stages, there are no symptoms. Type 2 diabetes, if left untreated over many, many years, can cause issues to your eyes, to your nerves, to your heart. So it's really important that it is treated. It can be treated with medication. In the earlier stages, often it can be treated with just lifestyle changes alone. The most important lifestyle change is to lose weight if you can, but also to increase your physical activity levels, reduce your smoking and reduce alcohol. The fourth number that it's useful to be aware of is your BMI or body mass index. Now this is a number that compares your height to your weight. And it's quite a controversial topic, and I think for good reason, because whilst it can be useful to know this number doesn't paint the whole picture when it comes to your health. Your weight might be higher because you're carrying a lot of body muscle, for example, which is actually really good for your health. And it's also important to understand where that additional weight is carried on the body. If you are carrying additional fat and it's around the base of the body, so in the hips and the legs, that's not really dangerous for your health. But if you are carrying excess fat around the middle, around the belly, well then that is an indicator of higher risk for things like type 2 diabetes, heart disease and even some cancers. So whilst there are some limitations with BMI, if we add in a 5th number, our waist circumference, that can help us make better sense of it all. Now a healthy waist circumference is anything below 94 for a man and below 80 for a woman in centimetres. So if it's higher than that, you might be at risk. But if numbers are not your thing, there is another way to check if you're at risk. And all you need for this is a ball of string. And you're just going to compare your height to your waist. In order to do that, you take the string, pop the end under your toe and measure your height, like this. And then you take the string and you're going to fold it in half. And then you're going to see if you can pass that around your waist and it meets. If you can pass it around and it meets, that means you're not at risk. If you can't get them to meet, that might mean you're at risk, and it's worth looking a bit further into it.